Good morning, everyone. Welcome back to this kind of videos about my transition on the medical school. In this case, we have assessment of technical English 2. My name is Pedro Plata. My ID is 152 34 31 in the section 30 with the Professor Morla. So, today, we have to discuss the oral practice that we have to conclude this quadrimester. So it's like the final step to conclude this very beautiful subject. So the first topic that we have is tell the names that the gadgets that you are saying. In this case, I'm going to use my auxiliary to tell you the names that I'm seeing. In this case, we have two. Oh, sorry. We have two. These are sphygmomanometer, pressure, and stethoscope. Hear the heart. So the first, pouch. The second, cuff or bracelet to put right there. The third, pump to make the pressure, and fourth, the valve to control the two. So the name of the next gadget that is a stethoscope, we have earpieces to hear the heart. We have the head pieces that is right there. We have the bell, the boot, and the diaphragm. There is the part that is capable to like transmit the sound of the heart. Very tasty good. So we have the next topic that are the parts of the body. So the parts of the body, we have two. We have anterior and posterior. In this case, so jaw, neck, shoulder, armpit, elbow, back, there is posterior part, buttock, posterior two, wrist, thigh, calf, leg. So the largest part of the body, chest, breast, stomach, or we can call tummy tuck, navel or umbilicus, it's up to you, hip, groin or inguinal region, knee, patella or kneecap, it's up to you as I said before, and the shin. We're going to continue with this topic that is internal organs of the body. So we can see the brain, esophagus, of course the mouth, lungs, heart, liver, bladder, large and small intestine, and the kidneys. Perfect. Now we have the skeletal system. The system is a little complicated, but nothing that we come to do. In this case, we have two skeletal models, anterior and posterior, as I said before with the parts of the body one. So, I'm going to tell you the parts of the skeletal system. We can start with the scum, jawbone, this breastbone of the chest. We have the choir, so choir bone. We have the rib. We have the tine tone, kneecap, shin bone, the shoulder bone, as I told you before, and in the posterior we have not only more like the vertebrae. In this case, we have the correct division. We have the cervical vertebrae right there. We have the scapula. We have the like thoracic box in Spanish, and we have the spine, of course. Now we're going to talk about gynecology, about women. In this case, we have an image that is illustrate the parts of the internal organs of the reproductive system of the woman or female reproductive system. In this case, we have the fallopian tubes, we have the ovary, the womb, we have the neck of the uterus, or simply we can call like cervix, because in this way it's easier to comprehend and to communicate in the English. And for finally we have the vagina. Okay, we conclude with this reproductive system, and now we have a box. So part A with a lot of words that we have to put to like make that this got sense. That's the word. So I'm going to use my auxiliary to read this interesting paragraph. So pay attention to me. When I get to the ward, the first thing I do is talk, of course, talk to the house officer who was on duty during the last shift. That's the one answer. To find out if there have been any new admission. The second. Then I generally see the church nurse. He told me if there is anything that needs to be done urgently, such as intravenous line to put up or take down later in the morning, clerk. Third, any new patient with basically involve taking a history on Tuesday and Friday morning, the consultant does her ward round. Fourth answer, and I have to make sure I'm completely up to date on her patient after that. There are usually a lot of things to do. I like writing up requests from blood tests, like frauds, and so on. In the afternoon, I have to prepare for any patient who are to be discharged to the next day. They're usually happy to going to home. Me too, of course. Program of Monday and Wednesday training. To conclude with this box, now we have the match or make a relationship with the words that we're seeing of the boxes. So in this case we have 1, 2, 3 boxes. The first box is about the cardiovascular system or the heart. For being more simple for you, I'm going to use my auxiliary. So the first box address arterial fibrillation, cardiac output, heart failure on a 4, beating, edema, premature beats. A little complicated this kind of situation of the heart, but we have to face it. So fake it until you make it. The next one is about the mental illness. So I'm going to tell you what are these. So behavioral syndrome, eating disorder, major depression, that is so bad, mental retardation, personality disorder, psychomotor disturbance, sleep disturbance, and substance abuse. And the next one, so we could say the last, is about like a very strange episodes that we have to face, like epilepsy attack. So we're going to talk of this. In this case, the last express the following idea: double vision or diplopia, epileptic fit, prodromal symptom, syncopical attack, urinary incontinence, visual acuity, like the vision that I got with my glasses. Without, I can see in that way. Perfect. So now we are going to talk about symptoms or illness that a lot of people that. For example, I have to be every half hour or so. In this case, is a frequency, yo. You have to make a pee with a lot of frequency. I get a scalding pain when I pass urine. In this case, is dysuria because you are presencing the pain when you have to pass. I have to get up several times to pass urine at night, nocturia, because it's owling on the night. So I have to rush to go to the toilet. Urgency? That's urgency because you have to like hurry up to get. I have a trouble getting a star. Hesitance in this case. So I can hold my water. In this case, we have to affirm that it is urinary incontinence because you can like make hard your bladder and you have to like be freedom to your pee for be like more explicit at a time to tell you. And the last, pass some blood in the urine. This case is hematuria because we have to take the point of the blood that every single person I don't have. What is the reason that is scared with that? Okay, now we are going to talk about some things. So I think like a little acronyms and a little things that we have to do perfectly. So in this case, I'm going to use again my auxiliary to talk to you about this topic. So give me a second. For example, the verse. So the UK launch of League attenuate in 1988. So this is Presa of Unknown origin. Second punch or varicella that I had in some series of my life is a common infectious become carriers of the virus. Rabies has an incubation period ranging from your days to many months. The patient remains febrile with peaks on temperature of 39.5 grays. So, he was admitted with a 4-day history of influenza type symptoms of fever with rigors, nausea, and general malaise. Quite a proportion of patients who recover from hepatitis B. So, become carrier of the virus because you can like make a totally like superation of the virus, like okay, I'm good. You have to carry it with the virus and you can make a blood transfusion. So the central part of America is in the midst of epidemic for AIDS, AIDS. So measles, rubiola is most disease of childhood. Lyme disease caused by transmission of B. Free from animal to man by toxic ticks. And the last, PUO or PUO stands for Presa of unknown origin. Perfect. So I'm saying that we have to talk about only one box of the doctor. So, first, in this case, it's acronyms. It's FI1 is a doctor that is in his first year of the foundation program. Demonstrator is anatomy teacher, so it's a teacher who teach the dissection of the cadavers. Okay, we have to follow with this box, but I'm going to find out my box to make a better explanation about this topic because I don't want that you're like a loss what I'm telling you. Okay, we have a lot of types of doctors like overseas doctor, etc. etc. So we are in clinic trainer is a consultant, of course, who provides training during period of direct clinical care. It's like the last year of the medicine, like the internet, rotatorius, like a drum in my idiom. So a supervisor is a consultant responsible for the training program of the training. So it's like the head in this program. We have a medical school, of course, is a part of the university that impart the career of medicine, pharmacology, nursing, etc. Okay, we have a plasman is we have that is a very span in train hospital. No, plasman is like a pill, but with sugar with a lot of people. Perfect. We have a college is colleague, college, as you wanna say. In this case, a good price that a colleague is like something equal to you, like a classmate. So a fellow is especially we have that is who has reached the highest level in their specialty. And in my opinion, this is very important to talk because we are going to do this kind of doctors in what series on our life. So we finish for today, and I hope that you like so much my participation in this oral test, and I hope that you're very well. Stay safe, wash your hands to avoid the coronavirus, and bye bye. I love you.